What's up? Hi guys, karibuni sana. This is your nurse Regina, and karibuni to my YouTube channel. This is another wonderful episode that we have. Today I have a health talk about home-based care, and yes, if you're new here, this is your nurse Regina. This is my YouTube channel where I have so many talks on health talk, lifestyle, makeup, cooking, and all that. So guys, if you're new here, please subscribe, keep watching my videos, keep liking and sharing to learn more and to grow with your nurse Regina. So as I said, by the way guys, don't mind my hair. As you can see, niko na head scarf, hata sijui kuzifunga, but yes, I'm there. So home-based care is what I will talk or take you through today. And what is home-based care and how you can identify a person or a patient for home-based care. Basically, nursing care or care of a patient or a sick person extends from the hospital to home, or sometimes it can just basically start there from home. So for example, you have a patient who has been admitted for some time in hospital and they need to graduate from hospital to home. So like, you don't need the doctor or the nurse to be always checking up the patient, or during the day always the doctor is there, but this care of a patient can be continued at home by family, relatives and friends. So this is a very sensitive time, or very sensitive time for the patient, for the person who is really sick, because they need to be taken care of. And home-based care can be extended to people or patients who need care, like the bedridden patients. These are people who can, or patients who are really sick and cannot get out of bed. And also we have they have needs like they have to be fed, they have to be bathed, to be changed, and they have maybe to be assisted to walk from one place to another, or when they want to do some exercises they have to be assisted. So basically the home-based care is a very important period of a patient or somebody who really needs care, because people or person who is taking for the care of this patient is somebody who is supposed to be sensitive, somebody who is supposed to be caring, and it needs a lot of moral support of the entire family and from friends also. So as I've said, bedridden patients are very sensitive patients because they can get bed sores. Bed sores, like they get, the skin breaks up and then they form sores because this patient is sensitively or most of the time on the bed and they cannot turn or move themselves. So it's good to make sure that this person does not develop what you call the bed sores because of having to sleep in one position for a long time. So basically the patient has to be turned, the patient has to be bathed, changed diapers if the person is using diapers during during the care. And these patients who are at home sometimes also need to be fed, and feeding a person is it's so precious, it's so graceful. As I'm saying, it needs somebody with a heart, somebody who is caring, and yeah, it's support from the entire family, because one person cannot manage to do it like daily because maybe you have other things to run along. So feeding can be done by supporting the person to feed when you're there, or you can literally do it yourself to feed this patient, because they need to keep their nutrition up to date, they need to feed to survive, they need to feed to get better, they need to feed to maintain their nutritional status. So apart from that, these patients at home have medication which they've been discharged with from hospital, and they need to be reminded that they take the medication, or sometimes you have literally to give them the medication because they're not able to do it themselves. So it's a whole lot of combination of support from family, from friends, and from even the doctor or the nurse, because there are what we call reviews or visits from a nurse or from a doctor, because the patient does not have to come to the hospital maybe all the time. You can assign a nurse or a doctor to come and see your patient, so that they can ascertain that this patient is just doing well, and yes, everything is okay. And at one point they can also refer or encourage the patient to go to the hospital again to be reviewed, maybe to be done some checkups, some blood works. Maybe when they develop some complication like fever, cough and all that, basically they have to visit the hospital once again for a better checkup and maybe change of medication. So at home, there are certain things that also patients need to be supported with, like patients who are doing physiotherapy, and this is where a patient is doing some exercises to enable their part of body to function. Like a patient has to be assisted to walk out of bed, they have to be assisted how to move their 1 or 2 limbs here and there, and yes, so home-based care is a whole big topic, and it involves a lot of things apart from what I'm going to just talk about. We have also the occupational therapy. This is whereby maybe a patient has a disability and they need to be like fit in some gadgets like shoes, special shoes, and then assisted to use them here and there. They have to be given a wheelchair, they have to be given some walking support. So all this is about the home-based care, which a patient or somebody who is in need of the care, apart from being in the hospital, can be extended at home. And basically this is all about making sure that this person gets to life, to get to heal and to get to normal life like they used to be. So apart from that, also the home-based care can involve things like counseling, and this is being able to encourage these people that they are going to get better, they're going to be back to normal, they're going to walk like they used to walk, they're going to wake up out of bed like they used to walk, and basically it's a whole, I find it's like it's a whole lot of something, a combination of 1, 2, 3 things. Not only the medication, not only the feeding, not only the bathing or changing the patient, but it's a whole package of care that I said several people must be involved to be able to achieve a whole healthy person who is maybe going to get to normal life. Or sometimes the patient can be just being done palliative care. This is a patient, for example, who is not going to get back to normal again, and they have to be supported at least as they are ending to end their life. Then they do it peacefully, they do it with love, they feel like they're loved and supported by their family and their friends. And yes, so home-based care is it's a whole package of things, as I'm saying. And so I'll encourage people who have like patients or people at home, the aged people, even children or just their children, friends who are in need of support, to do it gracefully and to be supportive in one way or another, so that at the end of the day, this person we are taking care of will get better, or will get to feel that they are loved and appreciated still in the community. So well, let me sip some water. So guys, yes, that was the talk today. And if you're new here, this is Regina, your nurse. Subscribe to my YouTube channel, Regina the Nurse, and watch my videos. Share and like, and also leave a sweet comment on the comment section. I'm so thankful for your support so far. Thank you for subscribing, thank you for finding time to be here, and thank you for watching my videos always. Let's move, let's learn, and let's grow with your nurse, Regina. Ciao.